Welcome to the Naperville Eldercare channel, brought to you by kwetters and the great folks of Right at Home of Chicago's southwest suburbs. Today's guest is Susan Werlein, Director of Business Development for Peace Hospice and Palliative Care.
Welcome back to the Naperville Eldercare channel. We are pleased today to have Susan Werlein from Peace Hospice and Palliative Care. First, maybe, Susan, if you could tell us a little bit about your role at Peace Hospice.
Well, I'm the Director of Business Development at Peace Hospice and Palliative Care. And basically my role is to educate the community, our partners in the community, as well as being part of a cohesive team with our clinical staff, our community relations managers, which I mentor and direct them into the field, so we can all work cohesively together to bring the best possible care to our patients and their families.
Wonderful, wonderful. Now, how long has Peace Hospice been around? Do you recall?
We've been in business almost 10 years. It'll be in September.
Gee.
Yeah, and we're located at 1717 North Naper Boulevard in Naperville, Suite 301. We're right on the corner of Naper Boulevard and Deal Road, right by Marriott.
Yes.
In the International Business Center.
I came right by there this morning.
Oh, that's good.
Now, what do you have a website?
Yes, our website is www.peacehospice.net.
Wonderful. Now, is there an intake number that if someone wanted to reach you?
Yes, if someone wants to learn more about our services, we cover 12 counties, so we've got nurses and staff all over the place to serve the needs of our patients and families. Our number is 630-649-7630.
Great. Now, when you think about hospice, sometimes folks become a little depressed with the term. What are some of the services? Could you maybe go over those, and maybe it would enlighten folks as to what hospice is?
People are so afraid of the word hospice.
Yes.
And hospice actually comes from the Latin term hospitium, which means hospitality. And it's actually, I call hospice a gift.
It is.
Because people don't realize they've bestowed on this gift to them for years. You know, we work so hard for our families and our friends and our community. Well, we pay into our Medicare benefit, and we pay our insurance premiums every month. So the event that somebody becomes ill, they can utilize that benefit, and all the services are covered under hospice. So you get a doctor, you get a nurse, you get a CNA, chaplain, but it's kind of like an a la carte service because you can pick and choose your care. It's your benefit.
It's customized.
It's customized how the patient or family wants it.
Wonderful. Now, so you cover 12 counties, so all of Chicagoland is in your area. Yeah, wonderful. Now, when people hear hospice, sometimes too they get confused. What's the difference between hospice and home health or other types of medical care?
Well, between there's three I would bring up: hospice, home health, and well as palliative care.
Palliative care.
So we do palliative care. Palliative care is pain management. So that does not include the services of hospice. But palliative care is just pain management. So if someone is still needing curative measures, like they need to get surgeries, or they need to get chemo, or they need to get physical therapy. I mean, we do other services like on top of that. However, when they're hospice appropriate, meaning that there's no curative measures, and that if they've been, some of the signs and symptoms are have your loved one been into the hospital more than 3 times in the last 6 months. Those kinds of things. How many falls have they had? Are they getting reoccurring infections, whether it's a UTI? For those who don't know, that's a urinary tract infection, or their dementias, or they're really declining in health and they're losing weight. Those kind of things.
So failure to thrive.
Yes, exactly.
Kind of a term
that's a wonderful term to use.
Now, when someone is thinking about exploring hospice, what's some things, the criteria that how does the process work if a family's wanting to explore it? What things have to be in place?
Okay, well, a lot of times, and like we mentioned before with home health, if someone, let's say, breaks their hip and they're being rehabilitated to get back, so they can get back to their home and they can function the way that they were before. Well, sometimes when the decline happens, when you notice that your loved one is not doing well, the criteria is that you first speak to your doctor. You need an actual physician's order, a doctor's order, to actually be evaluated. Sometimes doctors may feel, just some doctors, I'm not saying all doctors, may feel that hospice is not necessary. However, if the family feels that they are, All we have to have is an order so we can actually evaluate. We don't have to treat, but we can evaluate. And then if they are hospice appropriate, then we can treat the patient. So that's the criteria. It has to be from a doctor. Now, people always say, oh, it's only 6 months or less.
Right.
And that's the big, but that's the government. And I've always told people, Medicare made it a guideline that it's 6 months or less. That now, does it mean you're going to pass away in 6 months? Not necessarily. No. I mean, if I had a crystal ball, or if I could tell people you're going to pass away, I'd be God and I'd be out of a job.
Right. There
so
you go.
That's what I let people know. So
true.
It's a guideline, and I always tell people, can you imagine if if the guideline was a year or less, everyone would be on hospice.
Right, right.
So it's just a guideline from the government because Medicare is very strict, which I think is good too, and really monitoring the diagnoses and for the patients and their families, because a person who's put on hospice actually lives 33% longer than someone who's not on hospice.
33% longer.
Correct.
So their quality of life, it's all about their quality of life.
Right, and it's giving hope to the family because it's taking that financial burden off of them, because hospice not only helps cover the DME equipment, the bed is delivered, diapers, or I call adult underwear.
Adult underwear, yes,
wipes,
it's a good term.
the low air loss mattress, oxygen, anything that they need to be comfortable so we can give them their quality of life. So that way the family can actually be a son or a daughter to that parent and not a caregiver to that parent.
Now, is medications covered as well?
Yes, they are. Yeah. We use a company called Uvanta Pharmacy, and when a patient is put on hospice, we first order the DME equipment, things that they need for whether they're in a home, assisted living, memory care, independent living.
To get set up.
To get them all set up. And then the pharmacy usually delivers within a 4-hour window.
4 hours? That's pretty quick.
Yeah,
yes.
And our turnaround time is pretty good with the referral process. I mean, I got a call on Monday during my meeting and said this family wanted to meet right now. So I immediately left and went to the hospital and met with this family because they needed the help.
Wonderful. Now, who is eligible? Is it an age, or is it
No, a lot of people think that you have to be older, that you have to, we do take most private insurances. We've had patients, we don't do pediatric hospice, but we'll do patients that have insurance, above 18 years of age. And we've had people in their 20s, 40s, 80s, almost over 100. So it just depends. Sometimes, we take a lot of insurances that some don't. So sometimes these other hospices will call us as well, or hospitals, because a certain hospice won't take a certain insurance.
Yes.
So we will.
Now, when they get the doctor's order and then they give you guys a call, so it could be hours before.
It could be hours. It also depends on the case and the severity of the case. You just never know if they're imminent. That means, a lot of times families call like a couple of days before they pass.
Right at the end, yes.
Because they weren't educated enough, or they didn't understand hospice, or they're afraid of the word. So as soon as we get the referral that comes in, we make sure that we have the doctor's order, and then myself or our community relations managers will go out and meet with the family, and they have to sign consents. It's not a contract, and this is what I tell everybody.
Right.
It's just giving us the ability to bill Medicare so they can utilize the services that were already bestowed upon them.
Right. Now, kind of a sensitive question that just come to mind while we were talking. To be on hospice, does one have to have a DNR, a do not resuscitate order?
No, you do not have to have a DNR to be on hospice.
That's a misconception sometimes.
It is a misconception.
Well. Yes.
That's correct.
Now, what if their condition improves?
Well, this is the great part about it. If their condition improves, we've actually discharged patients before because they've gotten better on hospice. So we throw them a little party. I've done that before where I've brought some cupcakes and balloons, but we still monitor those patients and keep in contact with them to make sure that, if they do in the future decline, they know who to call and that we'll be there for them.
I read an article that had some data about kind of the most prevalent diagnosis. Is cancer
Cancer's a big one, but some of the bigger ones are CHF, which is congestive heart failure, COPD, Alzheimer's, dementia, those kind of things.
And people don't always think about Alzheimer's and dementia using hospice services.
Correct, and then a lot of people too are afraid, especially on dialysis. We've had patients before where, I can't continue dialysis, but they're on hospice for their congestive heart failure, but they're still continuing their dialysis services.
So that is a great thought, because you would just hate for someone not to have that extra time because they had a misconception about dialysis.
Right. And I think one of the important things too is when I talk to families is I always tell them, ask them what their loved one would want. And I always, sometimes I bring this up. I've experienced hospice personally through my father-in-law, and he wouldn't mind that I'd be talking about this, because he actually just said one day to me, I don't want to go back to the hospital anymore.
Oh,
I don't want to be poked and prodded anymore. I don't want chemo anymore. And he had already known that it was so aggressively, spread aggressively, that there was nothing else that the doctors could do. So he says, I want to die in my own home. I want to be around my family, and I would like to try hospice care. And I said, okay.
We had a client recently that just made that edict to her family. It's like, no, I'm not going back. It's not going to happen. And
so I just tell families, listen, it's hard because you love your parents so much. I have an elderly parent, my mom, and she's still very active. But the event that she becomes ill, I'm going to make sure that she's taken care of.
Well, one of the you hear from some folks, one of the fears is if they start pain medication, that they will be a term, it's not my favorite term, doped up. That's not my favorite term, but you hear it.
Exactly. No, the whole purpose of hospice is to give them their quality of life and to make sure that they're comfortable. Now, and that's where we don't do that. We want them to be as conscious as possible, so they can have the joy with their family and the whatever their last days may be, to spend that with their family. Yeah. But every case is different. There's 4 levels of care in hospice. I didn't know if you knew.
Yes.
And the most common one, 95% of the time or more, is routine care. And what that means is that once or twice a week a nurse comes in to see the patient. They'll do check their blood pressure, their pulse ox, their respiratories, all that kind of stuff. And then our CNA comes in 2 to 3 times a week, and they make sure that they're bathed, that their hair is combed, or rub lotion, those kind of things. And then we have a wonderful music therapist as well. We have 2 now, actually. And then we have 2 chaplains as well for spiritual services. Now, since we are a Christian-based hospice, if someone does not want to have a chaplain, that's fine. Our chaplains will actually step back and just be that companion that they need to maybe read a magazine to, or the paper, or just sit and talk to, or listen to music and things like that. I also go in and I check on all the accounts as well, saying, how are we doing? What could we do better? What are some things you'd like to see from us? Just to make sure we're keeping that partnership strong, but also that communication active and ongoing.
That's really important, because they're under stress and they're tired, frequently sleep deprived. So just reassuring and making sure that they know you're there is an important reinforcing
Absolutely. And
message.
Then with the other 3 levels of care, there are 4. There's routine, which is 98%. Then we have GIP, which is general inpatient, which has to be in a hospital or a facility that has 24-hour nursing care.
Oh, yes.
And then respite care, which is wonderful. And that helps too with with your services as well, because a lot of times families are exhausted, and they're taking care of their loved one in their home, so they need that respite stay, and they can have that in a facility. They can have at a hospital. They can basically wherever the family may need. So a lot of times families will say, well, what do you recommend? And we recommend some certain nursing homes or assisted livings that the family. And then if they need a caregiver, that they want that extra support, then we call people like you right at home and say, hey, we need someone to be with this with our hospice patient while they're gone on vacation. So it gives them that 5-day break. You know what I mean? And then the last one is I call crisis care. This is when a patient is symptomatic and they're very agitated, and we have to sit bedside by the patient until their symptoms are managed and under control, and then we can put them back on routine care. That could take 4 hours, that could take 8 hours, that could take 12 hours. However long it takes, we are there with that patient continually in that crisis to make sure we get their pain managed and under control.
Stabilize things if possible. Oh,
correct.
Wow. Now there's when we think about pain management, it's a different world than it was 10 years ago, even, isn't it? As far there's some no one should be in pain, really, should they?
No one should be in pain. And this is what I tell people too: is imagine this: your loved one, especially who has Alzheimer's or dementia, and they have they always tell you, oh, my mom or dad has had reoccurring UTI infections. UTI infections are very painful, I don't want to elaborate on that, but
no.
For those out there who have had one, are not fun. But imagine being someone who has an Alzheimer's patient that cannot verbally tell you
what's wrong,
that they have it. So sometimes they show symptoms of agitation and or people think they're sundowning or whatever it may be, and it could be as simple as having a UTI infection. And a lot of people don't realize that if our patients do get a UTI infection, we will give them an antibiotic because it's giving them their quality of life. So we're not going to take away that medication from them. It's going to help them. Just like oxygen. We supply oxygen because that helps put air into your bloodstream, so it pumps your blood so your blood pressure can go up.
Now, that is a misconception that many have. I've heard it expressed so often. Now, it's a Medicare benefit.
It's a Medicare benefit.
But we, as a society, are not really utilizing that Medicare benefit as much as we could, are we?
No, and that's why we're educating. I mean, that is the whole purpose of my job, is to educate and to educate my team, and also to work cohesively with our entire team, because we are all educating every day. Our CNAs are educating when they're out with their when they're with their patients. The nurses, myself, my community relations managers, our owner Ronki Champion. She started this hospice because it was a calling to her. It just kept coming back to her, and
she needed to do this.
She needed to do this, and she's very hands-on as well. I mean, she goes out and will do consents. I mean, she is so cohesively part of our team. We all are, and that is a nice feeling to be a part of a team like that.
Absolutely, that's really key.
It really is
to a good any organization, but especially a hospice organization. Well, is there anything else we're missing that you can think of now that viewers may want to know?
The one thing I would like to let people know is that even if you think they may be hospice appropriate but you don't know, just give us a call. We'll come out and just have a discussion. And sometimes I've done these meetings with these families, or our community relations manager have, and they'll say, well, they don't really look like they're hospice appropriate. But at least we know we met with that family, so they know the event that they start declining, conditions change, and they can call us. Not to be afraid of the word. I mean, think of hospitality. It's a service you've already bestowed upon yourself. And don't be afraid of it. People are so afraid of death in this country.
We are.
And
we are as a
I always, it is as a society. So for me personally, I always tell people, I wake up every morning and I consider that a gift. Or pouring a cup of coffee, or walking down the steps. And when I see all of these patients that need our services, that's our goal. To give them quality of life and to give them a little bit of hope.
Sure. Now, could one more time share the contact information?
We are located at 1717 North Naperville Boulevard. Now, that doesn't mean if you live in, let's say, Riverside, Illinois, or you live, way far south, you don't have to live near Naperville. We have our corporate office there. That's where we meet as a team every 2 weeks. You have to, by law. It's called IDT. And we all come together, our clinical and our staff, and we review all of our patients and find out what we're going to do better for them. So, and our phone number is 630-649-7630. Our website is peacehospice.net.
Peacehospice.net.
We're also on Facebook. So if you want to see our music therapists singing, or see some of our meetings, or some of the things that we've done for our patients,
hey, there you
it's
go.
on Facebook, and you can see how we interact with our patients. Just recently, one of our families just really wanted a TV. And you cannot just go out and buy a TV.
No,
you just can't. I mean, you just can't do that when you're. That's considered, as you can call, inducement. So I went on my networking group pages and asked anybody if they had a TV that they could donate. So a family donated a 27-inch TV, and my daughter donated her DVD player because she's going to college and doesn't need it. And got her some movies that were donated. And before we left, she was watching Casablanca, and when we said goodbye, she didn't even hear us. She was so into the movie.
That is
so
awesome.
We brought her some joy. So that just makes me smile every single day.
Every day. Excellent. Well, thank you so much for being with us today,
thank you so
Susan.
much. I appreciate it.